Right, we've got a pretty good audience here. So looks like we're at 23 online, and we got a handful of people here in person at Escanaba. So I think we're going to call to order the September 27th meeting of the CEDS Committee. And we're going to kick it off with some introductions here. So I would invite anybody new that or hasn't attended the CEDS Committee meeting in a while to first introduce themselves. If there's anybody online, feel free to introduce yourself.
Hi, Sean Hobbins. I'm the Assistant City Manager for the City of Marquette.
Thank you, Sean.
I'll pop in really quick. It's been a while since I've said hello to this group. So I'm May Chupros. I'm the director of Partridge Creek Farm. Great to be here with everyone.
Great, thank you, May.
I'm Emily DeSalvo. I'm County Administrator for Delta County. I'm online here, so thanks for inviting me.
Emily.
Hey, Phil Britton. This is my first time with Fresh Systems.
Welcome, Phil.
I'll jump into Steve Gallant with the State of Michigan Labor and Economic Opportunity.
Great to see you again, Steve. Is there anybody else?
Can you hear
Alan.
me?
I can kind of hear you, Sarah.
My computer, I have a new computer. I need to get some headphones for it that work. Sarah Monty with the Marquette Food Co-op and UP Food Exchange.
Thank you. All right.
And Alan Barr with the bar team.
Great, thanks, Alan. All right, give it one more second if anybody else wants to jump in. All right, I'm not going to go through introductions with the rest of our crew here, just because I want to allow enough time for our speakers and some healthy discussion. So we have two speakers today, two guest speakers, and in our CEDS strategy, we have some goals for creating vibrant and healthy communities. So two of our guest speakers are experts from our region that are really specialized in the topic of community health, and they have some new and relevant information to share with the CEDS committee that I think could be helpful to learn about. And so our first speaker today is Kate Beer, and she's with the Western UP Health Department. She in the Western UP Health Department produced the UP Health Needs Assessment, and Kate Beer is going to share some information on that with us. So Kate, could I bring the presentation over to you?
Sure.
Okay. Yeah, that would be. And then the other direction is back.
All right. No, nothing is awkward, isn't it? It's all right. We'll just, you know, I can't like just dial a phone anymore. I have to actually look at because I'm so used to dialing a 10-key calculator that I can't. Oh, that's funny. It's opposite, they're like reversed. So we adapt. Yeah. Okay. Are we ready for me?
Yeah.
Okay. All right. Thank you, everyone, for joining today, and thank you, Ryan, for inviting me. We're real excited again at the Western UP Health Department to once again bring you this community health needs assessment. For those of you that are not familiar, and just a reminder for those that are, this is a collaborative agreement between the Western UP Health Department and the other 5 health departments in the UP. And what we strive to do is to collaborate with local healthcare partners, mental health care partners, and others to come up with a needs assessment that is really truly based upon the community health needs of our resident population here in the Upper Peninsula. So kind of as a background, what happens there is if hospitals, when they do, have to do, say, a community health needs assessment, usually based upon their tax return, their 990 that they have to file, they usually consult with an agency, and those agencies often come from other states. They're not familiar with our territory. They're not familiar with our residents. They're not familiar with our culture. And what happens is oftentimes the numbers that are available statewide and nationally for our area are very low. They have very low participation rates. So what we've done is, this is the second iteration of this, where we've done this UP-wide, is we send out about 28,000 surveys across the UP, and we've gotten enough of those back then to make this statistically significant information for our area. So this is information that is true and valid for the residents in the Upper Peninsula. We just recently published the 2021 version of this, just this last spring. We're trying to do some more forums like this to try to get the information out there as far as wide and generally, and then try to use this to foster some more discussions just like this on the health needs of our area. So I will go ahead and I just want to give note that Dr. Van Houw is our medical director for both Dickinson Iron Health Department and the Western UP Health Department. He put a lot of work into this iteration of the book. He made it extremely user-friendly. The old book was kind of just put together. This has tables and indexes, and he did a really nice job. We also have some help from Kelly Kam. She's a professor or associate professor over at Michigan Tech, who does help us with verifying some of our statistics. So just thought I'd mention those people. So today I hope to cover just some of the broad significant factors that we see in the UP. And we can get into specifics by county if you want to, but we kind of leave that to the local public health departments and the local hospitals to do. I think it's just helpful to point out some of the broad issues that we're seeing across the UP. So one of these things that continues to be an issue for us, of course, is the declining population across the UP. As you can see in this slide, our numbers have decreased quite a bit from 2020 or from 2000 to 2020 by about almost 7% decline here in Upper Peninsula, as compared to a little bit of a uptick or a stabilization for the whole of Michigan. When we look at comparing ourselves to 2015, which is the last data point that was available before this iteration of the community health needs assessment, we're down 4% from that amount. So, really, we've got some counties that are suffering quite a bit with population loss, whether that's, I think a lot of it has to do with economics and job situation. If you take a look at Gogebic County, they have lost in 5 years 12% of their population. And I'm not sure if you're aware, but there was a prison closing over there. So those employers have major impact. Ontonagon continues to be a spot where population is a huge issue. As you can see, in between this whole 20-year time period, they've lost almost 30% of their population. And part of that was, they had, first of all, the White Pine Mine closed in the late 90s, is that when it was, early 2000s? And then the paper mill closed also over there. So if we graphically represent this, and some of these graphs are a little bit busy, but when you're trying to do 15 counties, they kind of look that way. But I think that this is just a good visual representation of what was going on that chart there. So, we can see where all of these counties have just declined dramatically. And you can see Gogebic County is that orange there, where it just kind of nosedived in those years when that prison closed. So you can just see the real impact of having just one or two major employers in a county. So one of the things that we like to look at when we look at this population decline, that it actually becomes more severe or more important almost, not that it's not an important issue, is our elderly. So what we see when we see these population declines, a lot of times because they are employment-based, we see the outflux, I guess, shall we say, the export of working age citizens within our communities and families. So what happens is what gets left behind are seniors, those 65 and older, and a lot of times now, because that, you know, the families have had to move on to find other jobs, they're living alone. Maybe they've lost a spouse too. So we've got high percentages within our local communities that we've got a person who's elderly living alone. The significance of that is, you know, as this trend continues, we see a constant pressure on our services needed for elderly, particularly maybe home care or, you know, trying to keep them at home, those kind of things.
That's challenging, being that home care. I mean, I hear like on the national level, there's very few home care providers. They've all gone on to other jobs.
Mm-hmm.
So,
Yeah, there was a lot of consolidation in the home care industry, and now I see they're struggling to find employees just like everybody else is. You know, if we look at, you know, Delta and Dickinson County, you know, we look at, or actually mainly just Dickinson here, in 2015, so like when this last survey, the prior survey went out, they were at about 14%, now they're at about 19%. So, you know, you can see that there is an impact there of maybe the baby boomer generation too has something, you know, as that baby boomer generation comes of age.
So was that people leaving Dickinson County?
No.
Oh,
This is like people that live alone. So, you know, as our population ages.
I think I'm just missing the title on the top of that.
Oh, yeah.
Sure,
So it's seniors 65 and over living alone.
Okay.
So, you know, like I said, it's how do we start measuring the use of resources or the resources that are necessary to meet their needs to keep them at home?
Right. Oh, I agree. That is just, yeah, that's a real critical problem in the Upper Peninsula. There's no question about it.
So another big picture item that we do like to look at is some economic factors and poverty issues. So when you look at the poverty guidelines, the federal poverty guidelines, and that's what this slide here represents, a family of four, they live off of $27,750 a month. And that's considered poverty. And I don't know about you guys, but I would find it extremely difficult to live off of that with just one person. When we look at some of the individual counties here, so we've broken this up, you know, by county, the percentage of people in poverty in each county. Look at Luce County is at 19%. Okay, Gogebic at 17, Chippewa at 18. Delta's at almost 14. And then if you go one column over, we're looking at percentage of families that have children that are less than 18 years old that live in poverty. So these are our percentage of those families that, or those income level population that have children. So as you can see, we've got quite a few households that are reaching 25% or more of poverty level when they have children in the home.
Did you pull that out to single parenthood at all, or?
We have not yet. But we're doing per capita income here, so that kind of gives it as per each person in the household. So, so we all know that those that the federal poverty limit, like we just said, is it's there, but it's not a realistic number when you start looking at the different costs in each county or what it really costs to live. So we also this year put in a comparison. I'm sorry, this slide is so small, but it just, you know, with the 15 counties, it just kind of goes to show what we liked or we're looking at here is a comparison. So in the blue part of the line is where the federal poverty percentages for that chart that I showed you. But then we introduced the ALICE concept to it of where people are actually at and how many people are actually living under that ALICE. And I don't know, I would imagine a lot of people online here are familiar with ALICE. I always forget all of the acronym, but I do know is it asset limited?
Income constrained,
employed.
Yeah.
So you take a look at all of the extra expenses that come in, particularly now with the shortage of daycare and with the inflation and gas prices. You know, I think that this chart today, if we were to do this chart with real-time data today, it would be even worse than this. If you can even find daycare right now, right?
Yeah. I heard today that it's considered a luxury if you can find daycare.
Find daycare, yeah. You know, I think daycare, yeah, I think that's a whole nother discussion we could probably have is on daycare, yeah. So as you can see, when we put those factors in there that are not always accounted for in that federal poverty limit. And the nice thing about ALICE too, it's kind of adjusted by county, so you can get a picture of, you know, what the cost of living in a particular county are. You know, it really paints a little bit more drastic picture than what just looking at that federal poverty limit is. So, you know, I think, you know, we need to take that into consideration when we're looking at different programs and policies moving forward. So let me read the top of this. Access to care, the ratio of population to providers. So as one of the things that we do look at is, you know, how many providers for different services do we have within our communities, right? Of course, Keweenaw always comes in at 0 because there are no providers up there. They all have to go to Houghton County, which is a hop, skip, and a jump sometimes. But when you look at some of these services, particularly dental, you know, the state average is 1,340 people to one dentist. You know, look at like Elger County, 2,270 people for each dentist. Yeah, so it gets to be, you know, how do you manage that? How do you facilitate people going to a dentist when there are no providers, you know?
Keweenaw has
such a small population, plus they only have, or they don't have any like physical offices up there. A lot of times we meld Keweenaw and Houghton County together.
okay.
It's difficult to do a statistical analysis on Keweenaw County because when you do it per 100,000, like I'll do a death rate per 100,000 and it'll look like the whole Keweenaw County died that year. So you have to really kind of step back and interpret it. It's a little tricky sometimes. Look at Ontonagon for primary care, 5,800 to 1. And we just said a couple slides ago that Ontonagon now has the highest rate of people 65 and older living alone. And they just this last year, I know, closed their skilled nursing facility at Aspirus Hospital over there.
Why is that?
Economics.
Oh, economics. So
They just couldn't
get enough.
well, between not having enough people to work and the cost of running it. I mean, you know, as you get to that point where they're bringing in locums and you can't sustain that. Yeah. I think the other, like, Houghton in Baraga counties kind of stepped in and they were able to take their patients. So. Dr. Van Hal was real good with colorful maps. And I thought that this was very interesting. So this is the distance somebody would have to drive to a dentist. And he limited it to a 15-minute travel time. So if you live within 15 minutes of a dentist, you know, you're in the red there, okay? You're in anything else? Other than red?
There's no dentist in Elder County.
Yeah, this is Kathy Reynolds from over in Munising and Alger County, and we work on the health needs assessment in our office. We do have a dental office. We have 2 dental offices in Munising and had 3 before, but they're going down, but they've been in there for years. Is that supposed to be, where does that information come from? Because that
I'd
piece
have
of
to
it.
see the table. So, and this is a 15-minute radius or 15-minute travel time. So it's not, these aren't county borders on here.
Okay, so
So
you're
it would
saying
be-
if somebody lived in Chatham, because Munising has got 2 in town
Yeah.
and has,
So-
yeah.
So this represents people that have to drive more than 15 minutes to go see a dentist.
Okay,
And what we're
so-
really looking at is kind of comparing how we look to downstate.
Okay, I'm still a little bit confused. So that would be when you're saying those counties that are in the gray, it isn't so much possibly the community. What is that one? That one's not loose over there, the other gray one. I can't tell.
So part of Ontonagon is not served at all by a dentist.
Okay, so but with,
Part of,
yeah, and it looks like Manistee area doesn't have one either, if I'm correct.
That's right. We lost our only dentist.
Yeah, see, yeah, so we have dental offices. I'm just not sure why they're not showing up. That's just my question. Yeah.
and it could be, I can look up that data for you. It's in the book. It's probably, it might be just a couple years old or that kind of thing. Yeah.
Okay, yeah, and there've been dentists in the area for, I mean, not a lot, and we're low on it, but for as long as I can remember. So I'm just was curious. Thanks.
Yep. Access to care is continued would be improved prenatal care. So we do actually do pretty good with prenatal care here in the UP. We do a little bit better than the state. If you look at that top slide, at least 76% of our women receive care in the first trimester, which is pretty good. We've outdone the state a couple of years with that. Where we do start breaking down then is percentage of women that are tested for HIV during pregnancy, and then the percent that have heavy weight prior to pregnancy. Areas that we need to work on. And that, of course, varies quite a bit by county, depending on the services that are available in each county.
And I would think something that influences that number is gonna be if the story is that there's fewer of us and we're getting older, we're probably not having as many kids. Most of our young people, if we do have people that have moved, it's maybe child rearing age people that are moving out. So it would make sense that we're probably doing better than because we probably have fewer pregnancies. Unless those people staying in the retirement homes are.
For new daycare. One of the areas that the UP continues to struggle with maternal risk factors is smoking during pregnancy. Almost 25, also about a quarter of our pregnant folks smoke while pregnant, which is pretty astounding in today's day and age, I would think. Weight gain, we're kind of with the state, and then we do good with WIC. So the percentage of women that are on the WIC program and children is 44%. So we do pretty good with that. I think our numbers, they started to decline a couple of years ago, and I actually think COVID helped those numbers a little bit because we were able to bring WIC online, or to an online format where they could do online visits and didn't have to drag the 3 kids into the office, those kinds of things. And that's still operating virtually until at least.
That's the same as SNAP program?
No, WIC is different.
Okay.
So WIC is the Women, Infants, and Children and an education and nutrition-based program. So that's the WIC coupon that they get.
Okay, yeah, so in my day, which has been over 30 years now, since I had babies. So that was cereal, milk, cheese.
It's expanded quite a bit.
Okay.
There's different packages based upon your income and based upon too, if a woman is breastfeeding,
Okay,
they get, you know, certain additional benefits.
okay.
So access to care again, the distance to a NICU. So the only NICU that's in the UP right now is Marquette. So when we look at drive times from, you know, any of our locations, they're quite high. It takes quite a, you know, from some of our outlying areas, it takes over an hour to get there.
And then stay there while you want to be able to stay there and take care of your baby while they're in NICU.
Yeah. We do have, like, some of our communities go down Traverse City area, and then some along the Wisconsin border go to Green Bay or Wausau. But if you're in Ironwood, it's kind of a toss-up between going to Green Bay or to Wausau or Marquette. So here's where we're getting into crude mortality rates. So these crude mortality rates are, a lot of these causes here are reducible or preventable just by lifestyle choices, healthy living, access to good food, those kind of issues. So like I said, Keweenaw kind of doesn't get represented on here because our population numbers are very skewed. But, you know, we do have high rates of heart disease, high rates of cancer within our different counties when we compare those to even the state per 100,000. We can look at Menominee County, I guess. Menominee has heart disease of 304,000 per 100,000 compared to the state of 253.
Some of those dementia rates, like too, is that so much higher than the state, or am I looking at that?
I'm sorry, what was your question?
Or Alzheimer's, I should say. Alzheimer's disease?
Yeah, they are a little bit higher, yeah. Not sure why.
This is Phil. Is part of this due to the aging population up here? Like the higher rates of things like cancer and Alzheimer's and stuff?
Dr. Ben, how to look at that patient.
No,
What was it?
I would think that almost any disease that is, impacts more of our older citizens, we're gonna stick out like a sore thumb on some of these charts for
Yep.
sure.
And then if that's genetically passed down,
Mm-hmm.
and that next generation stays here, that increases their chances.
Mm-hmm.
That was a good project for Dr.
You're gonna go back with a homework assignment.
Yeah. Doing okay on time.
Yeah.
Okay.
about 15 months.
So I mentioned up front that one of the reasons our needs assessment is so robust is we do this survey. So we base our survey upon the behavioral risk factor survey that the federal and state government uses. And instead of just maybe one or two people in UP, we survey a ton. So we did have a drop in rates this year. I think we had about a 0.25% drop in rate of return this year. We're thinking that a large part of that is COVID related, particularly based on the blank ones that we got back that had comments written on them that weren't so nice. So, so we're thinking that might have had something to do with it. So
Because didn't want to participate because of COVID, or angry in general,
Yeah.
just life?
Yeah,
Okay.
we'll just leave it at that. I guess, we're looking at, well, what can we do differently, and maybe having it come from another organization rather than stamped with a health department, like, for the next iteration, look, kind of work good, and let's give us a chance to work on our, demeanor out there.
Can I interject something?
Yes.
I think part of it too is letting the population know, as a result of the feedback being received, this is what's happening. This is what communities are doing with it. And so I think just expanding.
Why is it
that-
important?
Yes, expanding that education throughout the UP could be huge in the next assessment.
I agree. So these are directly from the survey, and we put on here the, do this every 3 years, so we put on, what it looks like the last iteration of this. So people are saying that their general health is actually a tick better, right? No health insurance, that got better, and that's 2018 was the Affordable Care Act came in, and it was just at the tail end of it coming in when we did that survey. So that's actually gotten better. People are still not identifying that they have a personal health care provider. And about a quarter of them said that they didn't have a routine checkup in the last 12 months. We're still struggling. We've got 25% of people that say that they have been told they have a depressive disorder. Another 20% say they have anxiety. And there was a little bit of an uptick in people that use medication for mood. One encouraging point here that we think is going on, if you look at that last item there, people that have used counseling in the 12 months actually ticked up quite a bit. And I think we're kind of looking at it from a couple ways, that perhaps stigma around mental health has declined enough where people are more willing to admit that they need help or need to talk to somebody. Some efforts maybe that we've been doing out there have, reduced that stigma. Also, maybe there are some more providers than there had been a few years ago, or maybe telehealth, that kind of thing has really helped that.
I would think telehealth and that type of thing makes it,
a little bit.
I'm not having to go to a building, I'm not, whatever that looks like, and it's,
More approachable.
yeah.
Yeah, they don't know the person on the other end of the line like they know everyone in their community.
So that's a little bit encouraging, that some of the work maybe that we're doing, making a little bit of a difference, or people are more willing to reach out is what we're doing. Tobacco use continues to, be a little bit of a problem for us here, including smokeless tobacco. Of significance here is the vaping. Vaping continues to increase across our population. That continues to be an issue that we struggle with. Drinking really increased. Heavy drinking and the binge drinking, and we believe, we'd have to look at it a little closer, but, I would imagine part of it was due to the pandemic. And that's, what we're trying to kind of weed out on some of these numbers is what's driving it. Is it just pandemic, or did pandemic just kind of reveal some issues that are already there? And I want to point out, these always get me, that heavy drinker is 31 drinks, so that's a drink a day last month for a woman. That doesn't seem like much, especially when you go to a bonfire or something around our neck of the woods, right? Drug use. Drug use continues to be an issue for our population. We had a little bit of an uptick in people that have used prescription drugs to get high. Quite a bit of an uptick in injected or snorted to get high. And of course, we have our friend marijuana. As you can see. So we would love to find out how much of this is just people being honest now that it's legal, in Michigan, or how many people have started using now that it's legal in Michigan? I would love to find that out. And of course, marijuana use 10 or more times in the past 30 days. It almost tripled. And there again, you know, are they just admitting, finally feel that they can admit to that, or did somebody start using it? You know, that would be really good information to weed out. Our medical marijuana cards have declined, which I guess. And this is another extremely hard to read slide. As part of our survey, we list, I believe it's 16 questions, and we ask people to rate them within their community as far as what they think is a priority, what they think people should be working on, or, you know, organizations should be working on. What has happened is some of our items changed a little bit from the last, so some priorities have changed since the last survey. People have moved on from just health insurance. The first survey we had, everybody was concerned about health insurance, and they've kind of moved on to that and started looking more at mental health and unemployment issues. So what we see here is the #1 priority. Everybody now says that although they have insurance, the copays and deductibles are high, and I think everybody kind of complains about that at one point in their life or another, right? There's always a high deductible or copay. So, you know, I don't know how we would address that, and that's a whole, like, you know, whole nother committee for that, right? But people are still concerned about unemployment, wages, and economic conditions, and drug abuse within our communities. And on this slide here, it's very busy because we've also included not only this year's survey, but last year's numbers or last iteration's numbers so that you can see the difference. A lot going on here. So what do we do with this data? This book that we developed here is over 450 pages long. It can be found out on our health department website. Your local health departments have a copy too. We're trying to get copies out to partners as we can here. But the overarching goal here is to use this data to improve public health within our community. So we're in that process right now. We published and we're publicizing in you know, kind of events like this, the data and the importance of the data. You know, we've got county dashboards out there that are similar to last time, where they list each county's specific details. We don't show every answer to to the surveys for each county, but just significant ones so that we can track them by county. And then what we like to do in public health, I know we try to do this over on the Western UP, is we get focus groups together to kind of look at that data with a bunch of stakeholders in the room and try to come up with some local priorities to work on. We did this the last time over in the Western UP, and we came up with our own community health improvement plan. It kind of got shelved because of COVID, but you know, that's the goal, is to have some smart objectives that you can go back to and you know, kind of track your progress as a community. So now, you know, just as a process step on the Western UP's end, we would now take this community health improvement plan, compare it to the new data, and revise and establish new goals to kind of move that along a little bit. So each county is doing it maybe a little differently. Each public health department may be driving it a little bit differently. I know, like on the Western UP end, we like to keep all 5 counties kind of moving in the same direction. But I know that in some other health departments that are multi-counties, it's hard to get counties to all move in the same direction. So.
Hey, when is the next survey scheduled to go out? Do you know?
We do them every 3 years. So we did this one in 2020, so it would be 2023.
Okay.
How many surveys did you say you had to go up to 27?
Yeah, there's about 27, 28,000.
And what was the return, do you know roughly?
See, Dr. Van Hal question. It's in here, I can look that up for you.
Kind of.
Yeah, it was a little bit less, it was a little less than, the last
Really
time.
sorry for the person that had to process all the surveys.
Well, we do have one that's online,
Okay.
that they can fill out online, and then we pay Michigan Tech students to for a little stipend for data entry. So it works out pretty good. And actually, Michigan Tech has started a public health minor over there. So it's a good project for them to work on. All right.
Are you ready to take questions, Kate?
Yeah. Any questions for me?
Well, I'll start out here. I'm curious with the data and the trends that you have here about workforce development and what it kind of suggests what the future needs might be for healthcare jobs and skills.
Well, I really think that, we kind of look, we have to look at it a little bit broader. We've got needs on multiple levels, I think. I mean, we are looking here, a little bit at the elderly, but I think it's real important that the children that are here aren't left behind either, because they're our future. I know that we struggle a lot with, getting pediatricians, getting OBGYNs in our areas, getting the dentists, So I think we need to look at the whole person, and workforce development, I think, is key to moving forward, particularly in those areas. It's tight out there now, and when we look at workforce development, I think it's more than just training somebody to do a job. It's looking at how to support that person in that job. I've got nurses right now in public health that want to work full-time, and they can't because their daycare is closed one day a week.
Yeah, I was wondering how many of those positions are predominantly female occupied positions, and what are some of the barriers they're experiencing?
Mm-hmm. So, I think that those, like you said, barriers, they need to be looked at too when we're looking at a total workforce plan.
And those daycare centers need to be close by. They need to be where, moms can have access to their children during the day should something happen. Having to drive your child an hour away and back and then go to work is just not practical.
Yeah, and it, COVID has made that even more difficult. You get one COVID positive kid in a daycare and it shuts the whole daycare down, So, how is that going to look in the next few years?
Yeah, and I think that's also intimidating to young mothers that are trying to make career choices too. You're looking for a job that's going to support that kind of flexibility, because a lot of employers, you can't, like nursing, you can't just take a day off, or a teacher. If you don't have a sub or someone to fill in for you, you can't just drop everything and go pick up your child because another child tested positive for COVID at daycare center.
Yeah.
So, yeah.
I know, I'll use the Gladstone Rapid River schools. One of the things that they're doing, and they were able to fill all their positions, but how they look at people that substitute, whether it's bus drivers or teachers or whatever, they no longer have where they're gonna get called in. They pretty much are full-time subs. They come to work basically every day, and then they're put somewhere where they're needed, knowing that they'll probably be somewhere else every day of the week. And there are some people that love that opportunity for change, but that's one of the strategies they're using to help you know, offset when people have issues and can't come to work.
Interesting, I like that.
Well, there's a lot of, you know, I guess, if you take a look at what we've gone through the last few years, I mean, you know, meetings that are Zoom, that probably never goes away. I know, you know, at one point in my career, I used to fly to New Jersey for 4-hour meetings and stuff like that. And, you know, businesses are understanding that it makes a lot more sense to not travel as much in some of those things. Certainly where you're able to get together, it's preferable, but there's, you know, and not only with that, but then telehealth, some of the other things you make, you know, maybe services that weren't available locally. Now I still can do it locally because I can contact someone. And so, you know, those are positive things to improve the situations that you're talking about. But, you know, there still needs to be someone at the other end of the line that can do that. And if there aren't those people, obviously that hinders the output regardless.
You know, prior to the pandemic, I think one of the challenges that we had as a region was having people focus on preventative health care. And now because of the pandemic, everything else has just exploded, but that underlying thought about preventing versus treating it after the fact really needs to be magnified more in the community, because when you look at the pre-diabetic rates, and those have the opportunity to be reversed, you know, and how many people aren't paying attention to that, you know, and how could that impact the region based on our high diabetes numbers?
Right. Yeah, we kind of saw that in the numbers too, right? How many people have had a annual.
Yep. Well, and I think the pandemic, whatever we're going through, that'll be in the next assessment.
Yeah.
Exactly.
Because I think this just touched the very beginning of it and the attitudes and the practices, but I think the next one is going to, you know, be interesting to see how we've gotten through it.
Well, we have time for one more question, from the online audience. So if anybody has a question for Kate here, please, go ahead and ask it now. Doing one?
Chat.
Is there chat?
There's 14, I think, in there.
Yeah, I'm monitoring the
14.
chat, so. All right.
Not my book.
There's 3,500, about 3,500 surveys for each.
Oh, okay, okay.
Okay, well, I'm not seeing any questions here, so if nobody has anything else, then we'll switch over to our next speaker, and that is Elise Bur. Elise, would you like to, probably gotta switch over my presentation too. It's gonna be over.
Percent return rate.
Oh,
This.
I'd be interested to know too
Yeah.
I feel like I took it.
if the return rate on those came from the same geographical area every year, or was it heavy over, say, Chippewa one year, and was it heavy over towards?
We have that, yeah, we've got it broken down in here, of which counties submitted. Onondaga's usually the winner, which there's a lot of 65 and older that answer the survey. But that's one of the things, and why we have help from some epidemiologists and statistical, is we rate and weight those depending upon each county's demographic makeup.
All right, so kind of continuing the same theme a little bit. I'm here to talk a little bit about the Northern Michigan University Center for Rural Health. I'm gonna talk a little bit about a couple projects that we have going on right now, and then get a little deeper dive into a food project that we've been working on. And I'll just start by saying I'm not an expert in food. And I know that we have some of the people online who actually are. So I might defer some questions over to some of the people that I've been working with more closely, depending on what I get grilled on. So the Center for Rural Health was actually formed in July 2020, heck of a time to start a health center. So pretty much the first year and a half was virtual. I've yet to meet all the faculty and students and staff at Northern, based on hybrid opportunities available on campus. So I still feel like I'm a new employee, even though I've been there over 2 years now. But it's been a good experience. I work closely with the State Office for Rural Health, as well as the Michigan Primary Care Association and the Michigan Hospital Association. So I've been able to develop some good relationships. The mission statement for the center is to improve the health and well-being of Upper Peninsula residents and communities by developing collaborative partnerships that improve the access and availability of affordable quality healthcare services. So again, this isn't about the center knowing everything, but it's knowing people who know everything and kind of bringing people together to accomplish efforts. Our vision statement is that we want to be recognized as the regional collaborating center into strengthening the rural healthcare system. And so a lot of that is really just with these outreach, such as this meeting itself, you know, just educating people and letting them know about different opportunities that could exist. We have goals. I know that Ryan's going to send out the PowerPoint as well as the one-pager that I've provided to people who are here in person. But to summarize the goals, it's expanding access to care, improving the quality of the care that people receive, looking at the regional health priorities and trying to advance some of those solutions, and overall strengthening the rural healthcare system as a whole. So one of the things that we have that is just going to start actually this Friday is the first 2 years that the center existed, we had all of the Upper Peninsula universities get together and do a flu shot competition. This is the first year that all the colleges are joining us. And so we want to really highlight that with all of higher education coming together and doing this, it's setting an example for our communities, and how can we increase the flu vaccination rate within the communities just to show that preventative care side and increase flu, you know, rates over the next year. So we had a trophy that was created by one of our professors at Northern Michigan University. It's probably 3 feet high by at least 2 to 3 feet wide. And it's a really large needle, syringe needle. But he made it out of lamps and leftover things, and so it's pretty neat. Finlandia has won the competition the last 2 years, so it'll be interesting to see what happens now with the colleges joining us as well. But you may see we're going to be doing a press release about it. I'm going to try to buy some time at some of the athletic events to really promote this and try to encourage more action in our communities. We also have a National Rural Health Day essay contest that's going to be released October 1st. This is for high school seniors who attend school and reside in the Upper Peninsula of Michigan and intend to pursue studies in a healthcare related field next fall. So this is something you're welcome to share with people who you know in your community that might fit this bill. We had sent this out last year to superintendents throughout the Upper Peninsula. We kind of learned that we need to expand that reach to include more counselors, English teachers. We're going to reach out to the different HOSA groups that exist in the Upper Peninsula and really try to gauge with these students. Students don't have to be attending Northern. They could be going anywhere. We just want to try to increase the knowledge and education to open the eyes for people who are looking at healthcare in the future. The topic varies from year to year. The first year we wrote about preventative health. Last year we talked about, we wanted students to tell us how communities could better support their EMS agencies within the region. And this year we're talking about social determinants of health, focusing on the Healthy People 2030 movement. And we want students to tell us how could college and university students impact some of the social determinants of health that exist in our communities. So it'll be interesting to see what they come up with for that. So we divided the Upper Peninsula into 3 different regions. We have first, second, and third place prizes in each of those regions. We also post the winning essays on our website so that they can boast to others and have them read their essay. And it's really intended to educate the student while they're reading about the topic prior to getting the question, as well as the community when they read this. We talked a little bit about workforce, healthcare workforce a few minutes ago. We did a healthcare workforce summit in June. Worked very closely with UP Michigan Works, as well as the Michigan Center for Rural Health, Upper Peninsula Healthcare Solutions, UP AHEC, and Michigan Primary Care Association. We have about an 88-page report that came out of that based on different focus groups, a snapshot of job vacancies, and also surveys that were sent to both healthcare administrators as well as the boots on the ground. And so I provided a link up here that shows where you can find those results if you wish to dive into that a little bit more. So now we get into the food part of things. Right now the UP has a higher rate of food insecurity compared to the state of Michigan. Probably doesn't come as much of a surprise to many people who work in the food industry up here. We have a majority of the households falling below the state median household income. Kate mentioned a little bit about ALICE. I did include the definition on that because I wasn't familiar with it. So I thought how many other people may not be. So I threw that up there just to show you some of the statistics in this particular area for QPAD. I put together this little chart that kind of shows those rates, how that compares for the particular area that QPAD serves right now. The local infrastructure right now that was identified is that there's 94 different grocery or food markets in the Upper Peninsula with 12 selling local produce and goods. So these are statistics that came out of a needs assessment, which I'll talk a little bit about in a few slides. But when you look at that, I mean, that just shows you how much potential of how we could further be supporting our farming and agriculture that exists in the Upper Peninsula. So there's a lot of work that could be done yet in this arena. Of the 30 farmer markets, only 12 accept the SNAP benefits. So what could we be doing to get more people to accept these benefits and still support farming at the same time? There's a lack of infrastructure that supports the local food trade, including access to capital for farmers and the lack of packaging, processing, aggregation, and distribution facilities. So we know that there's one food hub that exists right now in the Upper Peninsula of Michigan. There are 2 shared kitchens right now in Delta and Barrier counties, and there are 12 restaurants that are doing farm-to-table sourcing. That's another area that could really grow a lot right now. I mean, if we had more people doing this. I see that somebody indicated there are more than 2 shared kitchens in the chat. This was based on a review that happened a couple months ago, so I'll have to follow up with the company that actually did that review to verify that. I thought there were 3, but they had indicated that there were 2 at the time that they gave us these results. So we had applied for a grant about a year and a half ago to the Michigan Health Endowment Fund. It was a nutrition and healthy lifestyle grant. We applied for $195,000. The project period will go through next August. The project partners on the grant was the Center for Rural Health, as well as UP Food Exchange, Feeding America West Michigan, Central UP Planning and Development, and Michigan State University, their research and education center. So the concept is really to get some of the bigger players together throughout the UP on this. We've got many other individuals and agencies that we worked with besides these initial grant partners. So it's been interesting to really combine and put everybody together. The overall grant, the initial part of what we had signed up to do was to conduct a feasibility study for an aggregation and light food processing facility. The second part of what we wanted to do was, based on that being sustainable, we wanted to put together a business plan. And then we also wanted to develop a capital campaign plan. So the entire grant was a planning grant versus a doing grant. We're just getting now toward the end of the feasibility portion of this grant. And what we've kind of discovered is that it may not be feasible right now based on the current conditions in the Upper Peninsula. And so our thought is to really pivot. What we heard a lot through surveys and interviews was that food distribution is a big challenge in the Upper Peninsula. So what can we be doing to impact the distribution of food that exists in the Upper Peninsula? And then really take a look at a multi-year plan that could have a phased approach. It doesn't mean don't go after a facility eventually, but how do we build up the region to be able to support such a facility? And then this could reduce having to truck in food from other locations for days or hours away, and really bring healthier food to people quicker and being able to support the local economy as well. So I included a definition of a food hub because that's a term that a lot of people throw around, but it really is taking a look at a centrally located facility that has a business management structure that does the aggregation, the storage, the processing, the distribution, really the whole thing. I see there's a lot of comments coming into the chat, but I'm afraid if I talk that, I'll get off base. So we'll go back to the chat afterwards to make sure I'm not being corrected on anything that I'm saying. But we wanted to just provide this to everybody so they kind of understood what we're taking a look at, because we don't want to just meet one particular component of what's needed. We really want to take a look at what is all encompassing and could really impact the region. So some of the data collection that we did May through June of this year, I presented to the Growing UP Agriculture Association in April and talked to them about this particular project as a heads up, so they would know that surveys would be coming, that we would be doing interviews, that we might be doing focus groups. To my surprise, I was told there'd be about maybe 20 to 25 people in the room. When I showed up, there were probably about 65 people in the room. So I was kind of like, oh, this is good. There's a lot of people in the room, more people to know about what we're going to be doing. What shocked me a little bit was probably 85% of the people were at least 60 and older. So one of the things that I started to think about is what is going to be the future of farming in the Upper Peninsula? What's going to happen when our current farmers age out? So that is what my biggest takeaway was from that day, really, was just thinking about what's going to happen. We have plenty of land that exists in the Upper Peninsula, but if we don't have people actually farming, then we're going to have to rely on trucking things in. And I'm not saying that there's one particular answer to our food insecurities. There's a lot of different efforts going on. I know recently May and Partridge Creek Farm were in the news about the great work that they're doing over in Ishpeming. There's a lot that could be duplicated and replicated throughout the UP in different areas, and there isn't just one answer. But one of the things we're trying to do is take a look at the entire region, because what happens in one area can impact what's happening in another. So we're trying to break down that silo and take a look at the entire, production of food and how that can be improved. So we did interviews. They were anywhere from an hour to an hour and a half per person, and we had about 30 interviews with farmers and producers, small business makers, food buyers, and stakeholders. I opted to do the stakeholders because I knew I couldn't hold my own with some of the farmers and small business people, but it was really interesting. Everybody was very excited to talk about it. They felt like this was something that really needed to be brought to the surface and have more attention paid to it. So it was great conversations. We had about 75 surveys that were returned that were actually completed. A number from farmers and producers. A lot of that has to do with the relationship that Sarah Monty and Dr. James DeDector have built up with the different groups that they work with and the different farmers that they work with through their businesses. So, so that was very beneficial to have them as partners because they're kind of the experts in the field compared to me. The interview and survey outcomes from this was that there is currently not enough production or interest to currently sustain a light processing facility, which is kind of a bummer because we just thought, of course there is, and nobody's just looked at this, you know, but we have a lot of hope that, I think if we educate farmers, if we take a look at supporting 4-H, if we try to build some future farmers, you know, that this is something that could still come to fruition. We have a lot of individuals that are trying to solve their own distribution challenges themselves. You know, we've talked to somebody who has a small business who is looking at investing more than $100,000 in a truck. Now, what would happen if we had 3 businesses invest into 1 truck and then coordinate that kind of distribution and that just cut your expenses by 2/3 as a small business? So I think there's some collaborative efforts that could be dipped into a little bit more. There's also a lot of grant-related efforts, which are great, but they're often being done in those silos. And that's not to knock any of that because, you know, it's great to get a grant and it's great to do what you can do. But taking a look at how sustainable is that action beyond the end of that life grant is huge. Because, I mean, I've been involved in the projects in the past, one in particular that I can think of where we did something with food at a community and we had a lot of people participate. But once the grant was gone and we weren't there, that was it. So just understanding, you know, how can you move that needle in a larger, you know, way than just what your small grant might be able to let you do. And I really believe in trying to, you know, identify the people that can help work together and move some of those initiatives forward. And you can only have so many grant partners when you apply for a grant, but that is not to say that you can't add more people into a project, you know, and expand some of that. There's another grant that I don't have on here right now that doesn't have to do with food, but I just want to give an example on this, is that I had asked another agency to actually be the lead applicant because I knew that the government would recognize them as an entity and they might be more likely to award it than they would if I had applied for it. So thinking of some of those strategies when you apply for grants, that can be huge. We were able to actually get that grant and bring about $1.43 million to the Upper Peninsula that we otherwise may not have received. So recognizing how you can strategize when you apply for those grants can be really big. So some of the things that partners have talked about, just based on where we are right now with this grant for the future potential, is to increase current farming production. You know, how can we do that? How could, you know, CEDS and QPAD, you know, be able to help move that forward? How can we look at the regional farming and the future of that? How can we better collaborate on distribution initiatives? I mean, you saw based on the surveys and interviews, we only reached out to so many people. So there's a lot of people that have yet to have a voice, you know, and where they stand. But beyond this grant, there's no reason why those conversations can't continue to happen and build some, I guess, a larger collaborative plan for the future. Leveraging funding opportunities both regionally and statewide. Personally, I feel like, shouldn't somebody in Michigan be putting in a facility like this up here? Because they recognize the food insecurity that we have in the Upper Peninsula. So why aren't they up here helping us build this building, you know, and taking care of us? So I feel like there could be money leveraged with MDHHS to do something like this. I've started whispering that downstate already, but until we can get more farming production up here, it's not going to do any good to really have those whispers. We want to take a look at increasing access to food, which is ensuring that individuals who are eligible for assistance actually get registered and then know how to use those benefits. So I think I might have the statistics a little bit off on this, but one of the examples that one of the partners had given was that there are people who come to the Feeding America food distribution trucks, and of those individuals, 70% could be eligible for SNAP benefits, but only 35% are actually enrolled. So what could we be doing in our area at those events to be able to get individuals actually enrolled for those benefits and taking advantage of those? And then overall, just developing a sustainable food system from production to processing to distribution, and how can we do that overall? There's a lot that could be done. I mean, I feel like we just got into the surface of this, but all of the partners have been, I think, very excited about this. There was an attempt to look at some of this data probably 8 years ago, and a lot of the partners had learned from that what they didn't ask at that time. So we're doing our best to be all encompassing right now in this project and thinking about what does this mean? What didn't we ask before? What could be done that wasn't done? Really trying to learn from that experience. And so I guess that's another tidbit, is that if you get a grant and it doesn't work out the way you thought it would be, what's your takeaway from that? Use that as that learning experience to see what you could do differently. One of the things that I had mentioned when we kind of started to realize that this may not come to fruition sooner than later as far as putting in a processing facility, I did not want to give up hope that that meant it would never happen. It was just kind of like, I felt like saying, but what do we need to know so that 5 years from now, if we're in that situation, what didn't we ask now that we needed to know? So we're trying to keep our eyes open about all of this as we move forward over the next year. And then I just included my contact information if anybody has any kind of questions at all. Feel free to reach out to me. And I'll go down to the chat thing just to see how many people corrected me. Maybe I'll let you do that so that
Oh,
it's
sure.
off your computer.
Sorry, Alex. Alex Kofsky, can't say it. Alex Kofsky says the Nagani City Center is a shared kitchen. And I think that just happened relatively recently. Sarah Monty says, true, but the company was looking at very specific types of licensing in order to count that. We know Phil is working on aggregating this information and can use that in the future. Phil says, I'm sure all over the map, Maddie, I remember the acronym is for that, it's Masonic Arts Building in Marquette, should at least be included, though they're the biggest and straightforward, most straightforward shared use kitchen. And I would also mention that May was here probably in the spring, presenting with us too on Partridge Creek Farm project. So, I guess we'll turn it over to any questions anybody has, but I did have a question, and it's kind of thinking about the UP Health Needs Assessment. There's a question there about 5 or more servings, or do you get 5 or more servings of fruits and vegetables? And I found that was pretty shockingly low. And thinking about demand and how, we can increase, get more people to eat things, that would increase demand and maybe, alleviate some of those farmers, issues with, with demand and supply. So I guess what kind of efforts are going on right now? I think MSU Extension probably does some things and Farmers School does some things, but what other kind of efforts are underway or could be underway for increasing that?
I'm sure Sarah Monty might chirp in on this one. But I think that, I guess I should say that there are some farmers who are interested in this kind of facility. There are other farmers who would want to wait and see how this works out before they decide they're going to put 50% of their crops towards something like this. So there is some basic interest in this kind of facility. And one of the things we had thought about was reaching out to schools, reaching out to hospitals, finding out would they be interested in like frozen carrot coins, things like that. I don't think farmers are going to expand their crop until they know how this would work. I think there's logistical things also as far as who's gonna move the produce to this facility? Who's gonna move it out afterwards? How will it get to where it's going? I mean, this is more than just a one-phase approach of, you know, putting in like a dry storage unit. So one of the things that, that we're going to consider over the next year as we move forward is looking at that distribution component and cross-docking and last mile and distribution. How could those things be impacted at a much smaller scale while we also continue to work with people who are growing and figure out more about how to sustain such a facility?
Elise, as you had referenced your survey, and, you know, certainly one of the things like we've talked about in general, the population is growing older, our farmers are in the same boat. Do we ask any questions about, you know, do they have a succession plan for their farm? You know, in many cases, it would probably be a family member that eventually is going to take over the farm, maybe some of their children, but it may be that their children have no interest in farming if they've been part of that, let's say, growing up. And, you know, are we left with a situation where we have a very good working farm, but we have someone that is at an age they probably don't want to do this forever? You know, if they don't have a succession plan, what happens to it? And then I'm almost thinking, is there a way, you know, whether it's through the Michigan State Extension or some of our programs that develop farming skills and that study, that we could match mate, you know, people that are interested in the industry to potential farms that could, you know, stop producing?
Yeah, one of the things I've thought about is meeting with MDARD. They knew about this grant when we first got it, but going to MDARD and looking at this from more of a state perspective, and then what could happen in the UP for support. And so developing more relationships with farmers and actually having these conversations from someone other than just Northern Michigan University, we might get more response and more insight into the future of what, you know, what's going to happen. I think looking at 4-H as well, you know, and what's being done right now. I mean, I never thought, I shouldn't say never thought, but 4-H was never in the first part of my mind when I started this job. And now I can see all these things, how they feed in together and impact, you know, everything from the economy to the health. So that's something to be considered. But I think working with something like MDARD will help us have it magnified.
No, they would be a great partner.
Yeah.
I could jump in for just a second. I think one thing we definitely need to be concerned about is how to do that succession planning. Absolutely. There have been some trainings or opportunities for people to learn about that, how to pass on the farm at different food summits that have been held. I do think that it is a really big issue with whether or not the families actually want to continue the farm. And that's not just here in Marquette. Almost everything we're talking about is a national issue. And the thing about food systems work, and this is probably true of most systems, is that you start to kind of move one part of the system and push it forward a little bit, and then you run into a problem where you have to pull along this other part of the food system to come along with it, or you're stuck. You can't move forward. So I just want to recognize that there's been a lot of different people working over the years on all of these things, whether that's communities that are trying to protect current farmland with zoning. So anytime we have zoning that protects large tracts of land around our communities, that's actually a good thing to ensure that land that's meant for farming is available. When we start getting all these farmers up here, right? When we start growing all these farms, we need to make sure that there's land available that hasn't been turned into a subdevelopment because we were also anxious for development up here. I think there's a lot to be said for the school programming. We kind of joke in the UP Food Exchange meetings about we're taking a real long game when you think about folks like Partridge Creek or about the North Farm School programming. We have a program that we're going to be working with Marisa to do some farm to school work in some different schools. And then also folks like Phil who are working on food safety and how can people, move that forward, and all the business development people like Alex or MSU Product Center. It takes all those folks to help grow these businesses. So I think in the future, any next steps that we do are going to be looking at all of that. How do we increase demand through education? How do we help businesses grow in a way that makes sense? We're also really interested in how we can remove the debt burden that farmers face that keep them from expanding or investing in the first place, when it can be so hard to make money on a small or medium-sized farm, especially with a rural population that doesn't have a lot of income to spare. So I guess I want to say thank you to all of you on the call that are doing that work already.
Sarah?
Sounds like we need to recruit farmers that have spouses who are dentists.
Yeah.
Perfect. No, the only other thing I guess I want to add is that there are a lot of foundations throughout the state that have been paying attention to this particular grant and kind of the work and the research that we're doing on this. And so I think that's a good thing. We've had at least one place say, tell us when you're going to break ground and we'll write a check, and we're not there yet. But the good news is we have that kind of support when the time comes and when we're ready to actually do something. So I guess I'm pleased, even though I'm not pleased it's not sustainable right now. I am pleased about everything we're doing and the relationships that we're building, focusing on this.
Well, I think I speak for everyone on the CEDS committee when I say we're all very supportive of your efforts, and if there's anything that we can do that you can think of to help move along your initiatives, then we would be happy to do that. The first thing I can think of is, integrating some of these goals that you have into our CEDS document as we revise that next year and make sure we can be more supportive of that. So thank you very much to both of you for presenting to us. I think we're just at time right now. Maybe we have a little bit of time left for any partner updates. If anybody wants to share any regional news or new and notable things going on at your organization, we have a little bit of time here. So somebody feel free to speak up.
Well, this is sort of related to the conversation in Elise's presentation, which is that a prescription for health program that ran this last year in 9 different communities has been refunded for another year. We'll be looking at some minor expansion, and one thing that really is necessary to make a program like Prescription for Health work, which would help make local food more accessible to people of a lower income, including the ALICE threshold, is communities investing in their farmers markets and ensuring that there is a market manager that is paid to do the work. We can't really expand this program into communities that don't have someone to handle that infrastructure and act as a fiduciary. So if anyone on the call is in an area that has not been running Prescription for Health and is interested in learning more, please contact me. I'd love to help bring it to your area in the future.
I also have another update. Thank you, Sarah. Thank you, everyone. So Partridge Creek Farm just broke ground on Friday on our new intergenerational farm, which is super exciting. It was really a beautiful event, and we're going to be moving forward next year. About a third of it, or about an acre, a quarter of what we're going to actually end up developing will be put into production. So we will start growing food there next year. I also want to do a quick plug because we also got second round of funding from the Spear Health Foundation to continue on with our food insecurity efforts. And we'll be developing 2 pilot trainings for this summer. One will be how to start a farm to school program in your school. And the other will be how to start a community garden. So we are opening up and have funding for communities across the UP, five communities for 2 to 3 people to come for these multi-day trainings. Food and housing will be, and travel will be provided. So if you are interested, or part of somebody in your community, specifically from the school, for the farm to school training, are interested, please let me know. We will have official signups for this in early spring or late winter, but I do want to just, you know, give this out to this group of people first to plug it. And if you have anybody, please let me know as soon as possible so I can start having that conversation. So thank you very, very much. And I hope you all are doing good and have a good day today.
Okay, I'm gonna pass it over to Donna until you can get your sound figured out.
Okay, hi everybody, Donna LaCourte, Michigan Department of Ag and Rural Development. Just wanted to shout out that our Rural Development Fund grant will be announced for a call for proposals. I think it'll be October 1. And if you haven't already, just Google MDARD grants, and there is a place that you can insert your email to get a real-time notice when that grant opportunity is made available. So it's done a lot of great work in the UP and probably could serve a lot of the topics that we talked about today. So thank you.
The link on the CEDS page too, so anybody else who comes across it can get linked into the group too. We're always adding new people, so that would be good.
It's kind of fun to see the evolution of people that are participating. And I'm just gonna say, it really has shifted so much, and I'm sure a lot of this is the pandemic too, to a lot of those kind of more social type issues, you know, and it's because it's there's such a connection there between economic development and those issues that are plaguing our communities, so.
All right. All right, if anybody else doesn't have anything to add, I think we're a wrap with this. So thank you for attending, and hope you all have a nice day.
Yeah, good meeting. Great meeting. Thanks, everybody.
Bye.